you have questions about Medicare, what it is and how it works, this video is for you. We'll cover the basics. It can be a lot of information to take in all at once, and if at any point you have questions, you can call us or contact Medicare directly. More detailed information about what I'm discussing can be found by clicking the links below the video. Let's get started. Medicare is health insurance sponsored by the federal government. You're eligible for Medicare if you are 65 or older. Some people under 65 may be eligible if they have certain disabilities or if they have end-stage renal disease. There are 4 parts to Medicare: Parts A, B, C, and D. Medicare Part A is hospital insurance. That means it helps cover things like inpatient care in hospitals, hospice care services, home health care services, or skilled nursing facilities. So, Medicare Part A is hospital insurance. Medicare Part B is medical insurance. That means it helps cover medically necessary services, things like doctor visits, outpatient care, medical equipment, and other medical services. Part B also covers a lot of preventive services, like flu shots and diabetes screenings. Later on, I'll discuss what isn't covered by Parts A and B. On to Medicare Part C. Part C is also known as a Medicare Advantage Plan, or MA plan. This is a plan that is offered by a private company approved by Medicare. A Medicare Advantage Plan is different from a Medicare Supplemental Plan or Medigap policy, even though they are both offered by a private company. If you join a Medicare Advantage Plan, it covers all Medicare Part A and Part B services. So, you still have Medicare, but Part A, hospital insurance, and Part B, medical insurance, are covered by the Advantage Plan, not by original Medicare. All Medicare Advantage plans cover emergency care and urgent care. In many cases, Medicare Advantage plans offer extra coverage, like vision, hearing, dental, and health and wellness programs. Most Advantage plans include Medicare Part D, which is prescription drug coverage. Let's talk a little bit more about Part D, prescription drug coverage. With original Medicare, if you don't already have prescription drug coverage, but you would like it, you have to join a Medicare prescription drug plan. Medicare prescription drug plans are available through private companies that are under contract with Medicare. If you don't currently have prescription drug coverage, you should think about joining a prescription drug plan as soon as you're eligible. If you don't join a plan when you're first eligible, but decide later you want to join, you may have to pay a late enrollment penalty. There are 2 ways to get prescription drug coverage. The first way is with Part D, the Medicare Prescription Drug Plan, which is sometimes called a PDP. Part D adds drug coverage to original Medicare and some other Medicare plans, like Medicare cost plans, private fee-for-service plans, and medical savings account plans. The second way to get prescription drug coverage is through Part C, the Medicare Advantage Plan, which is, as I said earlier, a comprehensive plan that also includes Medicare Parts A and B. Medicare Advantage plans with prescription drug coverage are sometimes called MAPDs. Now let's take a minute to talk about what isn't covered by Medicare Parts A and B, since these plans don't always cover all the services you may need. A and B don't cover long-term or custodial care, routine dental, eye, and foot care, dentures, cosmetic surgery, acupuncture, and hearing aids, or exams for fitting hearing aids. Even if Medicare does cover a service or an item, you generally have to pay deductibles, co-insurance, and co-payments. If you need certain services that Medicare doesn't cover, you'll have to pay for them yourself unless you have other insurance or Medicaid to cover the cost. Some Medicare Advantage plans may cover those services. There is insurance that can help pay some of the healthcare costs that original Medicare doesn't cover. This insurance is called Medicare Supplement Insurance, or Medigap, and is sold by private insurance companies. It helps cover things like co-payments, co-insurance, and deductibles. Some Medigap policies also offer coverage for services that original Medicare doesn't cover. like medical care when you travel outside the U.S. There are currently 10 standard Medigap policies to choose from, identified by the letters A through N. If you have Original Medicare and you buy a Medigap policy, Medicare will pay its share of the Medicare approved amount for covered healthcare costs, and then your Medigap policy will pay its share. As I mentioned earlier, Medigap is different from a Medicare Advantage plan, even though they are both offered by a private company. Medigap is different from the Medicare Advantage plan because it doesn't offer Medicare Part A, B, or D benefits. It only supplements your original benefits. If you are enrolled in a Medicare Advantage plan, you are not eligible for a Medigap policy. So there you have it, a not very short explanation of Medicare. If you have questions or need more information, give us a call.